everyone, this is Divya from Quick Mommy Hacks, and today we have Dr. Devanshi Shah from Partum Therapy. So, hi Devanshi, thank you for joining us today to talk about pregnancy nutrition. It's great to have you.
Thank you so much, Divya. It's nice to be on board.
So, my first question for you is what role does nutrition play during pregnancy?
So, nutrition is very important when it comes to the mother and the baby. Okay. So, remember, the baby is getting all its nourishment through the placenta from the mother. So, the mother needs to be nourished well with all the macro and micronutrients so that the baby gets enough of it. Again, eating well during pregnancy helps to keep all those hormones a little stable because, like we know, during pregnancy, the hormones create a havoc in our body. You're having
Mm-hmm.
cravings, you're having morning sickness,
Yeah.
you're having a lot of those things. Also, postpartum, it gets easier to go back
Mm-hmm.
into shape if you've eaten well throughout pregnancy because then you're
Mm-hmm.
going to have the optimal weight gain.
Yeah.
When it comes to your baby will be of the right weight and it helps in the mental and physical development of your child. So
Mm-hmm.
that is also very important.
So, in your opinion, exactly what kind of key nutrients we should include in our diet during the first trimester, second trimester, and third trimester of our pregnancy?
Right. So I recommend iron and folic acid, not only in your food, but also in the form of prenatal supplements. These are really good because they help in the development of your neural tube, which is your brain and your spinal cord of the child. Okay, so these are two things which are really important. Next, what we come to is vitamin D, very important for the bones and teeth of your child. Again, if you're going to be deficient in vitamin D, you're going to have a lot of aches and pains. Plus,
Mhm.
the nourishment is going to be drawn from your bones and your teeth. That is
Yeah.
something that you really don't want. So, vitamin D is something very important. Next, what we come to is vitamin A, which helps in the formation of the heart, eyes, and ears of the child. So eat good amount of vitamin A, but again remember vitamin A needs to be eaten in limits. Overdose of vitamin A can be really hazardous for the mother and the baby. So please see to it that you just have limited quantities of these. Next, what we come to is zinc. Zinc is very important when it comes to the growth and development of your
Mhm.
child. So have a lot of zinc in the form of the oysters have a lot of zinc. So that's one option what you can have. Last but not the least is what I come to omega-3 fatty acids.
Mhm.
They are really amazing even prior to pregnancy, during pregnancy, and postpartum because these really help with the development of vision and intelligence of your child.
So, Devanshi, gestational diabetes is something which women get diagnosed with when they are in their second trimester. So, can you avoid gestational diabetes with good nutrition?
So, gestational diabetes is basically when the woman's body is not able to produce enough amount of insulin. Okay, so
Hmm.
yes, it cannot be avoided as such because often there's a little bit of genetic involvement too when it comes to gestational diabetes. But you can cut out the risk factors with the right diet. You need
Hmm.
to exercise and eat well. These are two things which are really important. Also, your food needs to be high protein and low carb. This combination should help you overall.
So, often people say that you should eat for two people when you're pregnant. So, exactly how many calories do you require, when you're pregnant or extra calories?
Right. So first of all, you don't need to eat for two when you're pregnant.
Hmm.
Okay. Remember, you just need to eat enough nutrients for two. What I would like to
Yeah.
specifically say. So 300 calories a day for a single pregnancy is what I would recommend. That is equal to maybe two rotis, 1 cup of vegetable, and 1 cup of curd, or maybe 1 glass of milk, one slice of bread, and one apple. These are few combinations that suffice at 300 calories. So it's actually not much.
Yeah.
But
Hmm.
when you're having a multiple pregnancy or twins, you need to have 600 calories a day.
Hmm.
So yes, you do not need to eat for two. That is a myth.
Yeah.
You just need to eat those additional calories.
So Devanshi, there's a huge list of foods that should be avoided or reduced during a pregnancy. So, in your opinion, what are those kind of foods that we should avoid during pregnancy?
So first, what I would like to say is avoid raw fish, okay? Because raw fish has certain types of bacteria which is not really good for you when you are pregnant. So please avoid that. Second, what we come to is raw egg. please avoid raw eggs because they have chances of having a few bacteria which might lead to various conditions like toxoplasmosis and listeriosis. So you don't want that. Next we come to soft cheeses. So avoid your blue cheese, your brie. All these
Mm-hmm.
cheeses are not good. You can have your cheddar cheese. You can have your parmesan cheese. Those are fine. Again, soft cheeses have listeria in them,
Mm-hmm.
so there are chances you might develop an infection. So please avoid that. Next, what we come to is alcohol. Yes, alcohol does get absorbed through the placenta to the baby,
Mm-hmm.
and we need to understand that the baby is not developed enough to eliminate it from their body really quickly, how we are.
Mm-hmm.
So I would say avoid alcohol because sometimes mothers who have a lot of alcohol, the child develops a fetal alcohol syndrome, which is a lot of conditions combined together, and you wouldn't really want that. Next, what we come to is smoking. So,
Mm-hmm.
smoking is a complete no when it comes to pregnancy. Even passive smoking is something which I would say avoid, stay away from people who smoke because tobacco leads to calcification of the placenta, and that is going to lead to reduced nourishment and oxygen to your baby. So, smoking is a no. There's no optimum dosage when it comes to smoking. When it comes to caffeine, limit to 2 cups a day. Don't go overboard with it. That is around 200 milligrams per day. That
Mm-hmm.
is something which is fine. But if you can completely remove it from a diet, that will be amazing. When it comes to medications
Mm-hmm.
and drugs, okay, we need to understand that though our placenta is really amazing in providing the baby with the immunity factors and the nourishment that it needs, it is not flawless. The
Mm-hmm.
drug is going to get absorbed and it's not good for the child. So I recommend that before you pop a pill for that backache or the
Yeah.
acidity or the
Mm-hmm.
heartburn or the nausea, please get in touch with your healthcare provider whether that medication is safe to take during pregnancy or no.
So next I wanted to talk about cravings. So is it true that pregnant women crave only those foods that their body need?
Well, no, it's not that pregnant women crave foods that their body needs. It's because of the hormones in your body that you might crave probably a sweet or something. But like I said, the right kind of nourishment, those cravings can be kept at par, so you need not
Yeah.
worry. But again, if there are women who are craving non food substances like, say, soda or clay or sand, that's a condition called pica, which is
Mm-hmm.
mainly severe mineral deficiency or severe anemia. So in
Yeah.
such a case, please get in touch with a healthcare provider immediately. Do not wait at all because this is something that needs to be attended to really seriously.
So women can have a lot of discomforts during their pregnancy. So are there certain kind of foods which can help avoid heartburn, let's say, or nausea, constipation, etc.?
So there are few rules that you need to follow with eating habits when it comes to pregnancy and these symptoms. So first is that eat 3 proper meals, which is your lunch, breakfast, dinner, and eat 3 small snacks. So basically, you're having 6 meals in a day, spaced out, and they are small meals. Hydrate yourself well, but remember to have fluids between your meals, not with
Mm-hmm.
your meals.
Okay.
When it comes to heartburns and acid reflux, I suggest do not have spicy food. Try and avoid spicy food. And post a meal, maybe walk a little. Do not lie down immediately.
Mm-hmm.
Give yourself that little time to digest
Yeah.
the food. When it comes to nausea, I really recommend that you take a carb with every snack or every meal. That helps to keep the nausea a little at bay. Have ginger, but have ginger in its actual form, not in the form of maybe preservatives or that form. Again, when it comes to nausea, please recognize the few odors of food that make you feel like that, and you can avoid them.
Mm-hmm.
When it comes to constipation, I recommend eat highly fibrous food and drink
Yeah.
a lot of
Mm-hmm.
fluids. And there are a few iron supplements that might cause constipation. So, if in such a case, you can always get in touch with your doctor to change that medication.
So in your opinion, what is the appropriate weight gain during pregnancy?
So, ideally, 7 to 15 kilos is the ideal weight gain during pregnancy, but it varies as per your BMI. But if your BMI is anywhere between 20 to 24, 11 to 16 kg should be good. But remember, your first trimester has to be the least weight gain,
Mm-hmm.
and your last trimester has to be the maximum weight gain.
So, how important are prenatal vitamins during pregnancy?
So, prenatal vitamins are really important not only during pregnancy but even postpartum. You need to understand that not everything you eat might cover up for the nutrients which you require. Okay, so you need to have your prenatal supplements because there might be days when you're not eating enough amount of nutrients, and these prenatal supplements will cover up. Again, in your first trimester, you might be having a lot of nausea, vomiting, so that's when most of your nutrients end up going. Your fluid goes away. So these prenatal supplements will help you manage those.
So, there are certain foods, for example, ghee or clarified butter or pineapple or papaya. There are a lot of myths about these foods, what you should include and what you should not eat. So, what are your thoughts about that?
So when it comes to papaya and pineapple, yes, it causes uterine contractions. So you have to avoid it. But remember, you can have the ripe form of papaya, okay? But that should be in moderate quantities and once in a while. It can't be a everyday thing.
Yeah.
Similarly with pineapple, it's okay to have it once in a while, but remember to eat the ripe fruit. Do not eat the unripe fruit. When it comes to ghee, there's a thing in India that if you have a lot of ghee, your delivery is going to be easy and you're going to produce a lot
Hmm.
of breast milk. Well, that's not true. Your delivery is not going to be easy if you have a lot of ghee. Okay, that's a
Yeah.
myth. Okay, so
Yeah.
remember to have ghee in moderate quantities. Do not have a lot of it. Next, what comes is there's a thing about dates because dates are heaty. Do not have dates, but we need to understand that date is an amazing food for iron. So yes, you can have maybe 1 or 2 dates, like maybe weekly, 2, 3 times. It's not going to be that bad. But again, when it comes to papaya, dates, pineapple, always first just talk to your doctor once because there might be reasons. Maybe your doctor might be saying no to have these.
Hmm.
So always confirm if you can have these or no. Another myth what is there in India is with warm and cold food. That if you have cold food, it's not good. Only eat everything hot. Well, there's nothing as bad warm food or bad cold food as such. But the only reason why warm food is recommended is because it takes longer to be metabolized. So metabolic rate is going to increase with that, which is really good for your body.
Hmm.
So these are a few myths which I think people might not know about and they just ignore it. But these are few reasonings that help you with why these things are there.
So, do you have any last piece of nutrition advice for pregnant women?
So I would like to tell all the pregnant women out there that eat well, eat all your macro and micronutrients, hydrate really well, drink a lot of water because remember the amniotic fluid is completely the water that you're going to have.
Hmm.
Have your prenatal supplements well. Go to your doctor regularly. Do not skip on your doctor's appointment. Exercise, what we recommend is around 150 minutes of exercise per week is really, really good. So you should completely do that. And yes, this is about it. I think just maintain these things and avoid alcohol, caffeine, drugs, and the foods that are to be avoided, and you should be good to go.
Yeah, I think all your advices were great, and I'm pretty sure people will find it useful. So, thank you so much for joining us.
Thank you so much, Divya. I hope this piece is helpful for people.
Yeah. If you like our videos, do subscribe to our YouTube channel, Quick Mommy Hacks, and follow us on Instagram for some personal tips on pregnancy, childbirth, and motherhood. And do leave your feedback and comments. We would love to hear from you.